Hey guys, it's Dr. Lauren Hartman bringing you the top 10 signs you need a geriatrician, or to spend some time on the ACE unit learning how to care for vulnerable older adults. Number 10. You think the beers list has something to do with happy hour. Number 9. You talk about the patient to others as if he or she isn't even in the room. This is very commonly done in patients with hearing impairment, visual impairment, and especially cognitive impairment. It's insensitive and degrading and should be avoided. Number 8. The letters NH, SNF, LTAC, ALF just sound like alphabet soup to you. 7. Your review of systems fails to assess geriatric-specific issues like falls, bowel and bladder incontinence, hearing and vision impairment, mood, weight loss, cognition, change in functional status, pain, sleep, medication side effects, and exhaustion. Number 6. You let patients stay in bed 23 hours a day. 5. You miss a diagnosis because it presents atypically. Elderly patients aren't just wrinkly young adults. They present differently. For example, an acute MI can present with delirium. Number 4. You fail to determine the patient's baseline functional and cognitive status. Physicians are commonly hyper-focused on patients' medical problems at the expense of functional status and quality of life, often mistaking the forest for the trees. Number 3. You let patients elect full code without fully educating them about the reality of CPR success rates in the old, frail adult. In frail older adults, survival rates to discharge are less than 1 in 10. Number 2. You trust a history from a patient without screening for delirium and dementia with a validated tool. And now, the number 1 sign you need a geriatrician. You assume evidence-based recommendations and guidelines apply unanimously to frail older adults. All right, so you might be wondering, what's a geriatrician anyway? A geriatrician is a medical doctor who is specially trained to meet the unique healthcare needs of older adults. By the way, the phrase older adults is the politically correct way to refer to geriatric or elderly patients. Acute illnesses, chronic diseases, and medications affect older people differently than they do younger adults due to multimorbidity, physiologic changes that occur with aging, and being on multiple medications. Geriatricians prevent, manage, and develop care plans that address the special health problems of the elderly. These problems are called geriatric syndromes, listed here. These syndromes are often multifactorial due to interactions between disease processes, medications, and normal physiologic changes of aging. During your ACE rotation, you'll become familiar with evaluating and managing these geriatric syndromes. All right, well, I hope you've enjoyed learning about these warning signs that you might need a geriatrician or more time on the ACE unit. Thanks for tuning in. Until next time.